Hi, I'm Dr. Bernard Starr. Now that the Pfizer and Moderna vaccines have gained emergency approval by the FDA, inoculations are underway. Does this mean an end to the pandemic? Opinions are divided. Many are optimistic and eager to get vaccinated. Some are hesitant and wonder if the vaccines have submitted to political pressure to rush them to market. Others ask, have the pharmaceutical companies skipped over usual guidelines for research and development to get to the finish line ahead of the 200 companies worldwide that are conducting clinical trials for vaccines, reported by the World Health Organization? Many of the open questions will linger until we have definitive evidence of the effectiveness of the vaccines beyond the clinical trials. The pressing question many are asking: can the high effectiveness ratings based on the clinical trials for the Pfizer and Moderna vaccines be trusted? That's the focus of my just published article in Op-Ed News titled, "Inoculation of Frontline Healthcare Workers Will Be the First Valid Test of the Efficacy of the Coronavirus Vaccines." Here's what I wrote with some additional elaboration and commentary for this presentation. If the Pfizer and Moderna vaccines prove effective with healthcare workers who are exposed daily to the coronavirus, that could provide the needed confirmation to convince doubters to get vaccinated. Radical changes in how we conduct our everyday lives during the COVID-19 pandemic have imposed a unique challenge for establishing the effectiveness of coronavirus vaccines. When you receive the vaccine, you are likely to follow the medical recommendations to continue safety measures. Dr. Anthony Fauci told CNN news anchor Jake Tapper on November 15, 2020, that he would continue wearing a mask after getting vaccinated, and recommended that everyone else should do so as well. To emphasize that point, Dr. Fauci insisted that masks and social distancing are here to stay. He added that although a vaccine may be effective, you don't necessarily know for you how effective it is. Dr. Natalie Azar, medical contributor to MSNBC, agrees with Dr. Fauci. After getting inoculated on the air with the Pfizer vaccine, she said, "Life will be no different," and then she listed all the safety behaviors for COVID-19 she will continue to practice. And I'm sure that will be true for many or most of us until we are certain that the vaccine is effective. But if most of us wisely follow Dr. Fauci's and Dr. Azar's guidelines for safety after inoculation, how will we know what protected us? The vaccine or the safety measures? In fact, we wouldn't know for sure. And that's the problem with the reported high effectiveness ratings of coronavirus vaccines based on the clinical trials. To test efficacy, both Pfizer and Moderna administered their vaccines to one group of volunteers, called the experimental group, and a placebo to an equal number in another group, that's called the control group. The placebo groups showed significantly more instances of infection than the groups that received the vaccine. Based on these findings, the two pharmaceutical companies declared their vaccines effective. 94.1% for the Moderna vaccine and 95% for the Pfizer vaccine. These are extremely high rates of effectiveness. However, there is a big but. To accurately evaluate efficacy also requires data on the post-inoculation behavior of the volunteers in the studies, both placebo and vaccine groups. What were their exposures to the virus after inoculations? Only if they are exposed to the virus can we make a valid assessment of the effectiveness of the vaccines. If most were taking extreme precautions, even isolation, few of either group may not have been exposed to the virus to put the vaccine to the test. That's a very critical factor. To understand the importance of this concern about behavior, consider this analogy. If the military provided enhanced protective gear to soldiers and then sent them home on leave for 2 months, the finding afterward that they showed no wounds would not establish the effectiveness of the new gear. That's obvious. Only when the soldiers return to the front lines of battle can the efficacy of the gear be assessed. Similarly, if you are not exposed to the coronavirus after getting vaccinated, how would we know if it was the vaccine that protected you, or would protect you, if you were exposed to it? Another analogy makes that point even more clearly. Pre-pandemic, when people received shots for the annual flu virus, they left their doctor's offices or pharmacies and returned to their usual activities: work, shopping, family gatherings, shaking hands, and other close physical contacts. They attended theaters and movie houses, jammed into packed stadiums, and used public transportation. In other words, their activities gave them extensive opportunities for exposure to the flu. Let's imagine that a comparable group received a placebo rather than the flu vaccine. They too would be engaging in the same activities that would put them at risk for the flu. If large numbers of the placebo group were infected with the seasonal flu and the vaccine group had few cases, we could reasonably conclude that the vaccine was effective. The crucial factor was that both groups likely had extensive exposure to the virus. Similar exposure can't be assumed for the volunteers in the coronavirus trials after they were inoculated. Even testing for antibodies in the post-inoculation vaccine group would not provide conclusive evidence of efficacy, since the vaccine itself produces antibodies. So how can we know if it was their behavior or the vaccine that protected them? The importance of that question is underscored by reports of a dramatic drop this year in seasonal flu cases in the U.S. and worldwide that can be traced to the widespread practices of wearing masks, social distancing, and lockdowns for protection against COVID-19. This welcome decline in seasonal flu cases is clearly not due to the efficacy of the flu vaccine, but rather those protective measures that people are taking. In a telephone interview, Dr. Amira A. Roas, professor of global health and epidemiology at George Mason University, agreed that data on the propensity for safety and risk behaviors within the placebo and the vaccine groups is essential for determining the effectiveness of the vaccines. She hopes that behavioral factors were included in assigning volunteers to the two groups, just as other factors such as age, race, and ethnicity are important in equalizing the two groups. She said, "In addition to matching the two groups on demographics, it's important to have that additional analysis, that is, the behavioral analysis." She added that for the rollout to the general public, quote, "It would also be interesting and useful to have post-inoculation behavior data," end quote. In a Zoom interview by Joseph Bonner, head of Science Writers in New York, on the issue of what does it take to create a safe and effective vaccine, Dr. Amit Kumar, CEO of Anexa Bioscience, a company that is developing vaccines for breast and uterine cancer, confirmed that risk behaviors should be randomized between placebo and vaccine groups in clinical trials. Thus far, no such data for the coronavirus vaccines have been reported. There is one sure way of determining effectiveness. It's called a human challenge trial, in which volunteers are exposed to a pathogen to expedite research on treatments and the development of vaccines, but also for testing effectiveness after inoculations. If both the placebo and vaccine groups in the Pfizer and Moderna trials were exposed directly to the coronavirus post-inoculation, that would have provided highly reliable and valid data on effectiveness. Then why wasn't this done? Human challenge trials that intentionally infect volunteers have been deemed unethical, particularly for the coronavirus, since there are no reliable rescue treatments for those who might have severe adverse reactions, or worse, catastrophic illness. That's why most governments, including the US, have banned such trials. But that may soon change. Nature.com reports that the UK is currently considering approval of a human challenge trial for the coronavirus scheduled to be launched in January 2021. Short of human challenge trials, Pfizer and Moderna will be implementing the next best test for efficacy in the initial rollout of their vaccines. America's 21 million frontline healthcare workers will be among the first, and should be prioritized, to receive the coronavirus vaccines. These heroes have shown one of the highest rates of infection. A study conducted by Massachusetts General Hospital, King's College London, and Zoe Global Limited found that frontline healthcare workers had a nearly 12 times higher risk of testing positive for COVID-19 than the general public. Not surprising, since they work in environments swarming with the coronavirus. After receiving vaccinations, healthcare workers will return to the front lines, meaning that they will be exposed to the coronavirus. If their infection rates after vaccination drop dramatically, that would provide significant confidence in the effectiveness of the vaccines. Let's hope the outcome supports efficacy. A clear path to the end of the pandemic may rest on these findings. Thanks for listening to this presentation, and until next time, stay safe and follow the recommendations of medical experts. I'm Dr. Bernard Starr.